If you follow the news, you may have heard the reporter that talk about an outbreak of cholera somewhere in the world. It may sound a little scary, but is cholera something you need to worry about? What is cholera? Cholera is an infection of the intestines. People get it from drinking water or eating food that's contaminated with a type of bacteria called Vibrio cholerae. Once swallowed, it settles in the lining of the small bowel and releases a toxin that can cause the body to flush liquid into the small bowel, resulting in watery diarrhea. Cholera is mostly found in the tropics, in particular Asia, Africa, Latin America, India, and the Middle East. It's rare in Canada, but people can still get it. People who travel from countries where the infection is more common can bring cholera into Canada. Some people in the United States and Canada have become sick from eating raw and undercooked shellfish from the Gulf of Mexico. So, how do people get it? It's yucky to think about, but people get cholera from eating or drinking food or water that's been contaminated with the feces of someone who has cholera. This is one reason why cholera is rare in countries with good sanitation systems. Things like flush toilets, sewer systems, and water treatment facilities keep poop out of the water and food supply. There are many other modes of transmissions. Feces of the contaminated person which carry the cholera bacteria spread by getting into the water supply, spreading to the soil, and picked up by flies or even touched by fingers. Each of these things are capable of infecting our food source so that when we eat we are also ingesting cholera bacteria that initially came from the feces of the contaminated person. Because cholera spread in so many different ways, the disease affects people all over the world. What are the signs and symptoms? Common symptoms of cholera and the dehydration it causes include watery pale color diarrhea, nausea and vomiting, dizziness, cramps, lack of energy, sunken eyes, dry mouth and skin, and irregular heartbeat. Cholera needs immediate treatment because severe dehydration can happen within hours. Fortunately, treatment is simple and very effective. The goal of cholera treatment is to replace all the fluids and and electrolytes lost through diarrhea and vomiting. For mild dehydration, a doctor may recommend drinking an over the counter rehydration solution. However, people with more severe cases of cholera may need to stay in the hospital and get intravenous or IV fluids. You can greatly reduce the risk of getting the disease by following a few simple precautions. Boil or disinfect any water that you'll use for drinking, washing, or preparing food. Fully cooked all foods, especially seafoods. Avoid raw vegetables, including salads and fruits that have already been peeled, and wash your hands frequently with soap and clean water, especially after you use the bathroom or before you prepare food.